All right. Thank you, everybody, for coming in and tuning in to the Disque Foundation and National Healthcare Provider Solutions Hour of Empowerment webinar series. Our new webinar series, and today we're really excited. We have the New Mexico Medical Reserve Corps presentation, and we're going to learn a little bit about the New Mexico MRC and how that's set up there, what they do, and if you're interested, what the MRC might look like in your area in New Mexico. Today we're going to have Luke, Robert, and Bobbie present on 3 different kind of aspects and how that works in New Mexico. And also kind of want to first give you a little framing on what we do here and what this webinar series is about. It's part of our Save a Life initiative. And if we go to next slide here, Robert. Our Save a Life initiative is our opportunity to help get a life-saving education and courses to people who need it the most. So we try to do this through technology, through webinars like this one, through our apps, through our online certification courses and videos, and it's giving people the chance, empowering them to save a life, which is really the mission here at the Disque Foundation and National Healthcare Provider Solutions, to get people the opportunity to empower to save a life. And if you can go next slide there, Robert, next kind of thing that we want to help frame it is 3 different webinar series. Our office hours with Lauren, which is a weekly opportunity after certification courses to come ask questions with our medical educator. Our CPR training, which can be booked at any time free of cost by groups with Lauren on your schedule and hers. Opportunity to log in, have the training, ask questions, more about CPR for say an AD with that medical educator as a group. And then our Hour Empowerment, our webinar series, now we're started here. And the whole goal is to connect you with health professionals who are doing best practices, innovative things, or helping people save lives in their communities here and around the world. And we want it directly from them to you. We're going to do this in an hour or less is our goal. And each one, if we can go to the next slide there, Robert, is going to come with a special coupon code 2. Empowerment is a 2-way street. It's Dr. Disque, it's one of his mantras and would help really lay the foundation for us here. So we will also post this code. It's nmhealth at nhcps.com. We'll make any of the courses you see there, CPR, First Aid, AD, BLS, ACLS, PALS, and bloodborne pathogens, completely free of cost, just by entering the NM Health at the apply coupon code checkout screen. So with that, I'd like to introduce our 3 presenters today that we're really excited to have. Luke Esquibel is our MRC Unite Leader in New Mexico, and Robert Perry is the Hospital Emergency Response Coordinator in Mexico, and Bobbie Mackenzie is the State Medical Reserve Corps Volunteer Coordinator in New Mexico. So thank you. Welcome, all 3 of you. Thank you very much for coming. And I'd like to start there with Bobbie to kind of get us going from the state perspective on the MRC.
Thank you for having us. I just want to give you a little overview of Medical Reserve Corps as a whole and what our organization is all about. The Medical Reserve Corps are local groups of volunteers that strengthen public health, reduce vulnerabilities, and expand emergency management capabilities. The MRC, or Medical Reserve Corps network, comprises of approximately 190,990 volunteers in 906 community-based units located throughout the United States and its territories. MRC volunteers include medical and public health professionals, as well as other community members without healthcare backgrounds. The Medical Reserve Corps units engage these volunteers to strengthen public health, improve emergency response capabilities, and build community resiliency. Basically, we prepare for and respond to natural disasters such as wildfires, hurricanes, tornadoes, blizzards, and floods, as well as other emergencies affecting public health, such as disease outbreaks. MRC volunteers training individually and with other members of the unit in order to improve their skills, knowledge, and abilities. Sometimes the training is coursework, and other times it's part of a drill or exercise conducted with partner organizations in the community. Continuing education units and credits are even available for some programs. After 9/11 and the anthrax attacks, a lot of people wanted to help out, but weren't prepared in advance. What the Medical Reserve Corps does is help to train and prepare people in advance to make sure that they are comfortable in their role. Our volunteers train individually or with other members of their unit in order to improve their skills, knowledge, abilities. And sometimes the training is coursework, and other times it's part of a drill or an exercise, and usually conducted with our partner organizations such as the Red Cross, the Community Emergency Response Teams, and other organizations within the community. Many of the MRC members are just like you. They're nurses, doctors, pharmacists, therapists, public health officials, and other community members. We take administrative assistants, restaurant workers. Everybody can have a role within our organization. And they just have to believe in keeping their local area healthy, prepared, and resilient. We share a commitment to helping others and making a difference before, during, and after public health emergency or disaster. Now, in an emergency, local resources get called upon, first sometimes with little or no warning. As a member of the Medical Reserve Corps unit, you can be part of an organized and trained team. You'll be ready and able to bolster local emergency planning and response capabilities. The specific role that you will play and the activities in which you participate will depend upon your background, interests, and skills, as well as the needs of the Medical Reserve Corps unit and community. Now, all emergencies start at the local level during a disaster, or our organized team of volunteers can assist with mass sheltering, points of distribution sites, communications, as well as logistical support. In times where there is no emergencies, our volunteers assist with communities by providing free flu shot clinics, first aid at community events, as well as family preparedness events. The specific role that each volunteer will play is dependent on their on their individual background, skills, training, and interests. So now, if you will, imagine a community or a nation in which everyone volunteered. Everyone would expand their skills and knowledge. Everyone would be healthier, and everyone would be more meaningful, having more meaningful life. In this future, we can all work towards, and this is what the Medical Reserve Corps is all about: neighbors helping neighbors, one community at a time. To locate an MRC unit in your area, go to their website, which is www.mrc.hhs.gov. So here's my contact information. I'm always happy to help answer any questions, help you find a unit if you need one. And now I'd like to introduce Robert Perry, who will talk to you about the Medical Reserve Corps and how they can help your regional healthcare coalitions. Robert?
Thanks, Bobbie. So as Bobbie mentioned, my name is Robert Perry. I'm the Manager of Emergency Preparedness for University of New Mexico Hospital. I'm also the Chairman of the Board of Directors for the Albuquerque Regional Coalition on Healthcare Preparedness. So I wanted to talk to you a little bit about integrating and what we're doing here in New Mexico in integrating healthcare coalitions and utilizing the power of the Medical Reserve Corps. So New Mexico, like many many states, is divided up into regions for their healthcare coalitions. We here in New Mexico use geographical regions. The ARCHP, or the Albuquerque Regional Coalition on Healthcare Preparedness, is mainly the metro area, and it encompasses 4 counties. But as you can see, like a lot of rural states, many of our coalitions are very broad and very large, encompass large geographic areas. And that is true here in New Mexico, as is many of the states that you live and work. So some of the things that the Medical Reserve Corps and integrating them into your healthcare coalition, as you can see, this is numerous amounts of trainings that we have done with the Medical Reserve Corps, and they, like you heard Bobbie say, they want to train. The healthcare coalitions have a duty to train and exercise together, not only with hospitals but other healthcare entities. And it truly is a best fit or a best match. In the top, you have a pod exercise where it was a mass prophylaxis for an anthrax attack. And then you can see different trainings and exercises in ICS, patient decon, patient mass casualty, patient treatment, and so on and so forth. And also it gives a sense of community, training together, working together, and learning from each other. Not like any other state, responses do happen here in the state of New Mexico. We have had to activate our emergency response plans for a number of things. This is just a few of them. Active shooter events, of course, who could forget Ebola, and it's always still fresh on our mind, but mass casualty events as well. And each one of these, even though they are a unique response, they do have a role where the Medical Reserve Corps could partner with response agencies and help them out. The two top are two recent bus crashes involving different commercial bus liners. There's one of them, they actually ran out of responders. They ran out of folks to in the hospitals to help take care of those mental health and those counseling and those needs. And partners like the Red Cross and the Medical Reserve Corps all can help fit that bill. So what we've done here in New Mexico is we've started to have a Medical Reserve Corps unit with each healthcare coalition. And our goal we haven't achieved it 100% yet, but by the end of the year, we will have a Medical Reserve Corps attached to each healthcare coalition. And it provides that response element. The active shooter incident that happened in Aztec, New Mexico, provided a great opportunity for mental health and oriental medicine and social work to go and respond to that incident to help the kids out of the school. Even though it wasn't a direct response from the shooting, it still aided in that community's recovery tremendously. And I don't think the community would have recovered as well as it did if it had not been for that Medical Reserve Corps up in there helping out those high school students. And again, back to all responses start local. So they are a local resource. They are local healthcare volunteers that volunteer their time, and integrating them into responses is crucial. Training together. Hospitals and healthcare coalitions have a duty and a responsibility per regulatory standards to train and work together, and the Medical Reserve Corps is just one of those partnerships that need to happen in your community as well. And they're a local resource, or sometimes an often forgotten local resource, but they are truly a local resource. Or learning different things from the flu shot clinics that we do here, and the exercises, and it allows the healthcare facilities within that coalition to easily incorporate those healthcare volunteers. I get asked many times, Ames, well, how, you know, I have a volunteer, a medical volunteer that wants to come volunteer in my hospital. How do I make that happen? What are the plans and procedures and protocols? The Medical Reserve Corps actually has those already developed and in place. So many times it's easy facilitation for healthcare facilities just to incorporate the Medical Reserve Corps volunteers, because they meet all those definitions that hospital standards have to meet to incorporate a healthcare volunteer into their staffing to help during a response. And again, back to community involvement. They're constantly, as you're going to hear, they're constantly doing community events, and they're providing that community benefit. And that's what a healthcare coalition is all about as well, is providing that community collaborative event. And here in New Mexico, I'm proud that we are starting to incorporate the Medical Reserve Corps units into our healthcare coalitions. I think that many times throughout the state, and other states in particular across the country, this needs to be kind of the model going forward for Medical Reserve Corps and healthcare coalitions. It does help in that response. Here is some of my contact information. In many ways to reach me. You're more than welcome to reach out in any way. I'm happy to answer any questions, what we're doing here in New Mexico, and why we took the model that we have of collaboration is definitely everything. So it's my proud introduction to introduce Luke Esquibel, who is the Medical Reserve Corps Unit Leader. He's going to tell you a little bit about the Medical Reserve Corps and unit that's attached to the Albuquerque Regional Coalition of Healthcare Preparedness. So Luke.
I am? Oh, I am. Okay, sorry. So I've been with the Medical Reserve Corps for, wow, 10, 11 years now, maybe 11 years here. So it, like Robert was saying, it starts local. One of the nice things about being part of the local unit is getting to know your community very well. You know, one of the prominent things I like to say, or proud things I like to say, is that, you know, I use the Medical Reserve Corps as a way of meeting new people. You know, one of the first things that you learn as a unit leader is, you know, responses are local, and you never know what's going to happen and when it's going to happen. So we always have to make sure that we're prepared. And that includes your family members. So, you know, one of the things that we like to train is, you know, incident command, you know, using logistical support for many shelters, for flu shot drives, for everything in life. You know, you can plan a great party by using incident command. You know, if you have family members that are willing to work with you to plan this party for your grandfather, your family member, incident command is a great thing. Not only that, but it keeps people safe. You know, we try to train and use incident command on everything we do, because the first person that needs to be safe is you and the rest of your volunteers. So, you know, safety is always a concern. And so this is basically a layout of what we might have for a shelter that we support. You know, we have other partners that we have in the community. Bobbie had mentioned the Red Cross as well. And so we partner with the Red Cross. We partner with you know, other organizations that might have barriers in situations where we can support a lot of the local things. But, you know, it's not just local. I mean, there are times where we can be activated in other aspects in New Mexico. So we can go outside our jurisdiction or community and support other. I've been involved with lots of activations in New Mexico, and it's just not here in Albuquerque, but in other counties as well. So sheltering, first aid, making sure that mental health is important, and mass prophylaxis, flu shot drives, things like that. And we always make sure that volunteers don't just deploy on their own. It's very important that somebody just doesn't go out there on their own and pretend that they're volunteering for our organization. We make sure that our volunteers are specifically trained so that way it keeps them safe as well. Also, it helps with preparing your family for issues. We had a power outage not too long ago here in New Mexico, and we were able to make sure that we had enough water and rations so that way we can survive for at least 24 hours, 48 hours, I'm sorry. It also kind of, you have to think, what about yourself, your medications, your self-well-being, your, things like that. And so it kind of helps you puts it in perspective of, hey, this is what I need to make sure that I need to take care of. There's also other ways to think about is like, what are your missions, and what kind of things am I going to have to look for in these things. So we have trainings on what to prepare for. How many days of clothes do I need to take? How many do I need to make sure that I have enough medication to last? Not just a volunteer, because as a volunteer, you're expected to take care of yourself and also others. So we have to make sure that we're prepared for that. And also, the way we do it is by phone tree, and tier tree. We, Bobbie contacts me, or Robert will contact me and say, hey, we're going to need X amount of volunteers to support this kind of mission. And so I need to make sure that our volunteers are ready to go at a moment's notice. Normally medical reserve corps units are 12 to 24 hours mission ready. However, there have been times where actually we are boots on the ground within 5 to 6 hours, depending on what the mission was. So it's always about being prepared. The other thing too is even if you're being deployed, you always have to have all your stuff in a row. So what's taught me is all my records, all my certifications, all my home things, like my house bills, my land, everything that has to do with personal things at home, insurance and so on and so forth. I have to make sure that they're taken care of while I'm being deployed. There are a lot of people who don't think about that, and they think about it at the last minute, going, "Oh my gosh, I forgot to feed my dog." So I don't have pets, but a lot of people who volunteer have pets, and so how do they take care of themselves? And so it's one of those things where it does help to the next level. Not just every volunteer for helping others, but it actually helps yourself. And so part of the mission sometimes is when we're working in a shelter, we help with intake. When a patient comes in, or when a victim comes in, that they're, let's say, I'll give you an example. We had a fire not too long ago, and we helped with the Red Cross and another area of shelters where we were taking people that were affected by the fire. They were told they had to, there have been fires across the United States right now, and they had to go in a moment's notice. They saw the fire, they They knew the fire was coming, but they didn't realize that they had to leave like now. And so a lot of people leave and they have medications that they need to be taking. Sometimes what we'll do is we'll help contact their physician or their pharmacy and help them get them refilled for a couple of days until they're ready to go home or until the fire is out. So we try to help with those kinds of things. Another reason why people don't deploy or don't go to shelters is because sometimes they don't take their pets. And so we make sure that there are ways of them taking care of their animals. So one of the things that we like to push out is have your own communication and plan. The state has a program. New Mexico actually has a program that we push out so that way people have an emergency preparedness plan for their family, right? Everybody has a family plan or a fire plan, but does everybody have an emergency go kit? Do they have a bag that has water in it, that has some first aid supplies, that have their contact information? There's a lot of people that don't write everybody has a cell phone these days, right? But do they have a list or an address book of people that they know, people who they can contact and say, hey, guess what, we're leaving, and so those kinds of things. I actually printed out a list of my address book and didn't realize I had 5 people in it. So I had to really go through it and say, okay, these are the people that I really need to contact for in case I have an emergency. And then, like I talked about, the pets. What about individuals that have needs, chronic needs, or special needs? Do you have everything that you need for that? Does the shelter have power so that way they can plug in their devices if they need it? I talked about working with other agencies here in New Mexico, and especially locally. We do drills together, like Robert was saying. We drill together a lot, so that way we know who we're working with. It's easier to work with somebody that you've met before, but it's not necessary. We try to put it amongst ourselves is that we treat everybody the same. Treat everybody like if we're taking care of our own family, and that's basically who your community is anyway. And then here's my contact information if anybody would like to contact me. I'm not up 12 to 24 hours a day, but I'm eager to answer questions.
Luke, thank you so much. That was Bobbie, Robert, and Luke. That was such a comprehensive and detailed overview at such a good pace at the same time. And not just such an important program, I feel, but an opportunity I think a lot of folks would take advantage of if maybe they knew about it as well. If it's okay, I'd like to just ask a few questions now that came to me and probably come to some of the viewers as well.
Absolutely.
Okay. Bobbie, I kind of wanted to start out with just what qualities make a great Medical Reserve Corps volunteer?
A love for your community, dedication, and the will to want to help.
I like that. It's straight to the point, but that rings true. Luke, you guys kind of all mentioned this phrase that all disasters start local. So in my mind, there's a major disaster and FEMA's there that day or the next day. What do you mean by that, and why is that important?
I'm sorry, repeat the question. I apologize.
Yeah, the phrase all disasters start local.
Yeah.
Can you explain that a little bit?
Well, in all fairness, anything that happens in your community is your community. So whether it be a power outage, whether it be something happened at a mill, and the mill starts on fire, or there's a roadblock because there's a spill of some kind. That even though it goes national, that's a local thing that happens. So what you have to do is you have to prepare for something that actually happens on that level. And if it needs national attention, then of course the circle widens. Then all of a sudden it becomes a different whole animal. You know what I mean? So then it becomes a regional thing, and then becomes a state thing, and then becomes a national. So everything that happens in your community, it always starts with that community, and then it goes on.
I think I would just add that you also got to remember from the context of resources. Like Luke said, it's your community. So all disasters always start in your community. And it's always your community first responders. It's always your community police, fire, whatever the disaster may be, that are showing up first. Then they're making that assessment of that disaster or that emergency, stating that, hey, we need additional resources, reaching out to the regional levels and the state levels if that's what it requires. And then from there, if the state, again, needs additional resources, they're going to reach to the federal government. And the federal government's going to provide those resources if they can. And again, we got to get back to, even once the federal government leaves, the recovery or the of that community, it's not the federal government recovering that community, it's the community recovering that community from that disaster or emergency. So that's why all disasters ultimately start local and they always end local.
I really like how you put that layer on there, Robert. Robert, question for you. I really liked how you guys, I mean, it's a joint effort, but integrated the MRC and the Healthcare Coalition. I think that's just such an opportunity of that partnership there. Now that you all have done that, Robert, what kind of advice would you give to some of the Healthcare Coalition coordinators out there who might be thinking of doing that you've had that experience now?
I would say first, find that medical, I have a great relationship with Bobbie. I have a great relationship with Luke. But find that medical reserve corps in your local area. There's got to be one. They're all over, as Bobbie mentioned. And find that leader. Start talking and having dialogues with that leader. Make sure Medical Reserve Corps is a representative of your healthcare coalition at your meetings. That's the best way to start to begin with. And then they get to learn what the Healthcare Coalition's about. The Healthcare Coalition gets to learn what the Medical Reserve Corps is all about. And then ultimately, it kind of falls in place. You're planning these trainings and these exercises, and the Medical Reserve Corps is right there, and they're like, oh, well, we can help out with this, or, oh, we would like to learn this. And the same thing goes us back to the Healthcare Coalition side. We're trying to scramble and figure out how we're going to incorporate healthcare volunteers into our healthcare facilities and still within the letter of the law. And again, I think you got to always invite each other to the table. Well, Medical Reserve Corps unit leaders come into the Healthcare Coalition meetings and vice versa. And that's where ultimately, that's how this concept was born, was that constant interaction, that constant training, that constant meeting, and ways we could help each other out.
I love that. It starts with the relationship and the communication. And I kind of wrap it up and ask each of you the same question. You all three have been involved in the Medical Reserve Corps now for multiple years. What's your favorite part about the MRC? If you had to sum it up to one thing.
I think for me, it's the friendships that you build. It's a sense of community and knowing that you're out there doing some good and helping people. I mean, we've had people that have coded on us, and because of our efforts, they live to tell it. And I think, and it's just the camaraderie. You become a family, and I think it's that family friendships and community that I love the most.
But what I like about it is I've learned how to use my resources very well, and the people that I communicate with are not just, you know, your regular Joe. You know, it could be the director of a hospital. It could be the director, and it could be your sports and wellness, you know, manager. You know, they're all the same people, and they're all wanting to you know, wanting to participate in things. And so those are the kinds of resources that we need. You know, we need those kind of community folks to help us on the next level. Like, you know, I don't know a lot about, you know, a certain thing. They do. And so it kind of helps me in the long run become a better person. That's what I like about it.
I have to say, so I agree with Bobbie about the people. The people, for me, that's what I love about it. Getting to meet and learn from different people is a great thing. Another thing that it's great for me, and oftentimes people don't hear it too much, is actually from the community. So those volunteers, they touch a life. They touch the lives of those high school students in the Aztec shooting. They touch the lives of the marchers that we help out when every time they get a blister on their foot and they come in and we're giving them Band-Aids and we're talking to them at the Bataan Memorial Death March. They see it and they recognize the amount of help, and they recognize that a lot of things couldn't be done without those volunteers. So for me, it's also not only the people I get to meet and the volunteers I get to work with, but also the community recognizing how valuable and how much it's needed.
Bobbie, Robert, Luke, very much appreciate from everybody at the Disque Foundation, our team here, you guys taking the time to share with our audience, which very clinical audience and non-clinical folks who are going to be interested in, you know, looking this up and maybe learning more about the MRC in their area. So to use this as a foundation or a spark or a catalyst for that is just a great opportunity. So thank you guys all so much for putting this together and taking the time out of your guys' schedules and coordinating. That's really very much appreciated.
Thank you for having us.
Thank you for having us.
Again, the NM Health for New Mexico Health, NM Health, all capitals, can be used at nhcps.com. That's completely free for the BLS, ACLS, PALS, and bloodborne pathogens for the clinical audience, and 100% free also for the CPR, AD, and first aid. On there also, there's, again, the webinar. You can have medical education with our medical educator, Lauren, to ask questions. You can access that throughout the year. Once you put in the coupon, it is yours, so you can revisit if you want refreshers on how to use an AED and that kind of thing. So please take time to empower yourself to save a life. That is it for us today, and we'll be back with the next webinar.